So my name's Sarah. I own Forageplus in the UK. It's a nutrition company, but I'm extremely interested in whole horse health and welfare. I was a barefoot trimmer, so as well as being an expert in hoof health and nutrition, I also spend time training my 5 horses using reward-based training. In this presentation, I'm going to show you how I use positive reinforcement to turn stressful or even painful medical procedures into opportunities for horses to participate willingly. I use small, thoughtful steps and clear communication to build trust, even with things which hurt like injections. So many horses find medical care frightening because it involves pain, pressure, or restriction. They don't understand why it's happening, only that they can't escape it. I want to give them understanding, choice, and predictability using learning theory and behaviour modification to counter condition procedures that can be aversive, frightening, and painful. Interestingly, research has shown that this approach is often discounted as being too time consuming, but actually, if it's done well, the safety and speed it actually affords is enormous. So what's learning theory? It's a way of describing how behaviour changes, and there are 2 branches. Classical conditioning, where, for example, a horse might associate the smell of a vet with fear, so they start worrying before the vet even gets near them. They've learned through association, classical conditioning, that the vet arriving means discomfort, and so therefore they get frightened. But we can use operant conditioning, that just means learning through consequences, to shape a new feeling about the vet. This is about understanding the 4 quadrants of learning and harnessing the power of positive reinforcement. I'll focus the next slides on using positive reinforcement to change or build behaviours, which is adding something pleasant that the horse wants so that a behaviour increases. This is because it's the most powerful and efficient way of training any animal. So if we use rewards that the horse finds motivating, usually food, because that is crucial to the horse, we create the motivation to take part and learn, just the same as in our life situations. We enable a horse who wants to take part, not one that just tolerates what we make them do. You can turn what are unpleasant experiences into ones which are associated with the horse being in control and enjoying the experience because of the association with the food, and that's because it's a primary motivator. I'm going to show you a video which shows the process of teaching a horse a head down cue, and this is one of the basic essential behaviours that creates calmness and is super easy to teach. Calmness around food, touching a handheld target would be trained before teaching the head down cue. And what we reward, we will always get more of. And it all starts with the calm to build trust and confidence. So the horse is Georgie and he's 17 months old and he's in his first training session to teach head down. He's never done this before. He already knows how to touch the target and that the food will come to him with his head in the middle of the chest after I click with my tongue. I chose this video because people say you can't use food within tyres and young horses because it'll make them dangerous. The video lives on the Forageplus Instagram page, and remember, this is the first time he's ever done this, and he understood it quickly, probably within 5 minutes, because he understands positive reinforcement. He hasn't got any fear or worry over what he's taught, and he's very curious because he's only ever been trained using positive reinforcement, and that promotes curiosity. So the video speeded up just to show you him touching the target, moving with the target. So now I'm going to change the behaviour. Instead of leading and touching the target with his head up, I want him to start to learn to put his head down. So the target will invite him to lower his head. So there, his head lowers a little bit. So I click and then I feed. Watch how far down his head goes the second time, because he understands. He's like, oh, well, that was easy. I just touch the target down there. Click and feed again. Then I wait, present the target. Now he's getting confident. You can see him getting confident. So I just repeat it a few times, not many. Now he's got it. So now I'm ready to see if I can do it. He can do it without the target. I don't always want to have a target there. There he goes. He puts his head down. Didn't need the target. I go back to offering in the target just so that I reinforce so he totally understands. Now I'm going, instead of the target being a cue, I'm going to bend. Can you see me bending? And I'm going to wait. And then he'll put his head down. There you go. So if I do that enough times bending and that process with the target, I literally end up with a horse that puts its head down when I bend. And then people don't know how you've done that. It's very cool. So in that video, I communicated to Georgie using a click, which marks the exact spot when he carries out the behaviour. Then the food arrives. This is important because it's a clear system which helps us be consistent in the reward food delivery, and that means the horse understands what it's got to do. You could see Georgie understanding exactly what he had to do. It's very clear. The click or sound is called a terminal bridge. It stops the behaviour and it's a way of saying, yes, you did it. You can use a mechanical clicker like the ones in my hand as the bridge, but I use a click with my tongue like that, not a light click to go forwards, just a. So I have my hands free for other things, including riding, because I use the same system to train horses when I'm riding. The other marker I use is a keep going signal, which reassures the horse that it's doing the right thing, but also the keep going signal can make a horse stay on a behaviour for longer. So I use good as my keep going signal. And these markers, the terminal bridge and the keep going signal, good, make learning clear and fast. Horses get really good at listening for them, which makes training super quick. So using learning theory and positive reinforcement, we can change how a horse feels about a scary experience by pairing it with positive outcomes, which are enjoyable. Over time, as we build training which rewards small steps to success, what once triggered fear starts predicting something good and pleasant. This is called counter conditioning. You can counter condition absolutely anything. Sprays, horses not liking ears touched, injections, separation anxiety, the smell of the arrival of the vet. It's super powerful once you understand learning theory and how to use positive reinforcement. So within this system, though, it's really important to allow choice to the horse. Traditional training allows the horse little or no choice in what we make them do. This leads to all sorts of problems which impact safety for both us and the horse. I train, so I always let the horse walk away, and I want him to volunteer to participate. The use of a pause bucket is crucial in this. Here he is going to his pause bucket, and being able to walk away and still have food shows them that their emotional needs matter and that they can trust us not to force them or coerce them by withholding food into something they don't understand or are frightened about. The video playing now shows my other young horse, Taylor, again an entire, and he's 2 years old, working on moving his shoulders towards me on mats. This is a very hard concept to grasp, and you see him opting to go to the pause bucket because he doesn't understand, and I've probably just gone too fast and expected too much. So if you watch again, I'm going to walk around the back of him. I'm going to ask him again, and he goes, no, I'm not doing that, and goes to the pause bucket. I haven't got a problem with that because it's quite possible he doesn't want to do it because it's physically too hard. 2-year-olds are not very coordinated, and if you move your front end, you've got to shift your weight to your back end. And how do you do that? And I haven't got a problem because it's not that he doesn't want to join in. It's just he doesn't know either how to do that. He's just not understanding, or maybe mentally it's too hard, and he'll follow the target. He'll go back to these other behaviours that he's really happy with. It's just that new behaviour that he's not quite got. So when I first started this, especially the pause bucket, I absolutely believed my horses would never take part, preferring to stay at the pause bucket and just be fed continuously. But I was wrong. I have 5 horses, and every single one of them would rather work out the behaviour puzzle with me. They only go to the pause bucket when they're mentally tired or confused by lack of understanding or physically tired. It's quite astounding. They'll even leave a bucket with food in and have me get on them. It's amazing. So what about if you want to train something painful? Well, I use a stationary target, and when the horse touches the target, it can then say, I'm ready. This creates a start button cue that something can begin, and it also helps distract and focus the horse's attention elsewhere. I train it by using a verbal cue. I just say touch. I point to it first and reward for the length of time the horse learns to keep its nose on the target. A handheld target like the one I was using with Georgie can train the touch first so that you can put the handheld target near the horse's nose and it bumps its nose on the target, and then it'll get the idea that you touch things with your nose and then you get rewarded. Anything can be used for the stationary target. You could use an old milk bottle, a cuddly toy. I use a boat fender, and I keep it for stationary tasks, and for injections, I train in the place where the medical treatment will take place. So you keep the context and the place clear for the horse. Having the place where a behaviour works, the context in which it happens, is very powerful for anchoring behaviours and making them stronger. So once your horse understands the nose on the stationary target, you can start to introduce the pretend injections. And I use increasing levels of pressure first with my hand. There's my hand. Then with a pen. Then I think I've got a metal chopstick here. You can use anything, it doesn't matter. And then I go to a cocktail stick because I can give them a right good stab with that. Each step is paired with positive reinforcement, that click and feed. And only when the horse is calm and confident can you then bring the vet in, who practices with exactly the same hand, pen, metal chopstick, cocktail stick procedure before then injecting or blood drawing. The more you can get the horse to associate the nose staying on the target in this process, and that signaling it's ready for you to do the cocktail stick or the injection through the start button behavior, then the more successful it will be. And believe me, you'll go from hanging on to the horse, volunteering, even without a head collar. So it's very quick once the horse understands positive reinforcement and the click and the feed situation. So for hoof soaking, poulticing, or even trimming, I use a platform where food is delivered. When soaking, the horse learns that standing with the hoof in the bucket earns the click and reward. I start with the hoof on a piece of carpet, then in a shallow bucket, then a deep bucket, then I start adding water. I wouldn't go straight to the deep bucket with water. Step by step, rewarding the terminal, bridge and food. I build duration so the horse remains calmly in place while I step away, then I come back to put the food onto the platform. The keep going signal tells the horse that remaining calm and staying there is correct. It's essential for longer tasks like foot soaking. This horse has a history of being very dangerous and very uncooperative. And this was the first time he'd ever had his foot in a bucket. And it took about 5 minutes to get to the point where I had the deep bucket with the water in. Then I had to train duration. And on the second day, I have video taking my hay down to my bottom shelter, which is at least 100 metres away. I hang my nets up, I trundle the barrow back, and he's still there waiting for me. And yet he was very dangerous, very uncooperative. And in the past, that would have been a nightmare, not using positive reinforcement. This approach has completely changed him. To teach tablet giving, I start touching the corners of the horse's mouth with my fingers, and I pair that with the click and food. Then I quietly change to popping in a hay pellet. You could use other food if you wanted to. Then once that is really strong and the behavior, the horse is actually enjoying me putting food in the corner of its mouth, I change to the tablet giving, and I pair that with a bucket feed when the horse has got a mouthful of food. Then the horse will no longer find the fingers in the mouth or the taste of the tablet unpleasant. Each time you give the tablet, if it's paired with a bucket feed and popped in the mouth when they put their head up to munch, and you're not forcing them to have the tablet, then it constantly reinforces a pleasant experience when giving tablets, and tablet giving then becomes very easy. Positive reinforcement isn't just about treats, it's about communication, trust, and giving the horse control. We have to abandon control and give it to the horse. The difference between this system and traditional training is night and day. And the result is horses that willingly say yes to care, even care that's painful or unpleasant. This is Morris, and I don't know why this video isn't playing, it should be playing. So this is Morris, who's 23 and was diagnosed with PPID age 17. And this is how I give him his tablets each day, trained using positive reinforcement. So he actively goes, where's my tablets? In a minute, you'll see him turn his head to me. Here he goes. I pop the tablet in the side of his mouth and I click. Did you hear me click? He used to be typical in refusing these tablets and spitting them out. And that's really annoying because they spit them out and then that's a pound of tablet on the floor. Now he knows what's coming, and pairing it with a pleasant experience gives him control. And then he gets a kiss because he's a darling. So watch again, listen for the click. And every day I repeat that, and every day it's got easier and easier. But I used to have a head collar on. I used to basically have him throwing his head up. Now he doesn't do that anymore. So know that cooperation isn't trained by control. We cannot control horses. They need to have the control. We need to give them the control so that our training is built through understanding, choice, and positive reinforcement. We give the power to the horse. It's amazing, really, that horses will give you permission to do stuff.